inventory management and purchasing of implants. Well, we all know how important the implant is in our procedure. The outpatient joint replacement model typically has a younger patient between the ages of 45 and 65. In fact, our average age over the last 10 years is 57. Thank goodness for new technology that allows our patients to have a joint replacement opportunity at a younger age. We hope these implants are going to last 20, 25, and maybe based on some of our laboratory studies and new materials, up to 30 years. Well, that implant becomes incredibly important. And so does your implant representative. What a valuable source of information as you try and build an outpatient joint replacement program. It's important not only to get the right price, but also, most importantly, to get the right implants and materials. Get the right backup. If something goes wrong, be prepared. Managing all this, obviously, is very difficult. However, over the 10 years that we've been doing so, we've developed a step-by-step plan to make sure implants are replaced. We always have the right implant. We're never looking around town for implants that we don't have during a procedure. Our experience with our implant representative has been amazing and such a valuable resource in making the outpatient joint replacement program a great success.